Hi, everyone. Welcome back to TXC Tells All. If it's your first time joining us, welcome to TXC. Today we have Nali Bedney as our special guest. She is a professional counselor, and we're going to be talking about the so important topic of getting serious about mental health. Should you get therapy? So I'm going to have Nali tell you a little bit about herself, and then we'll get right into the questions and the issues we need to talk about. Nali?
Hello, hello. Thank you so much for inviting me onto the show and talking about a subject that I am passionate about. As Tracy mentioned before, I am a licensed professional counselor in the state of Maryland. I'm also nationally certified within USA, as well as I have a specialty in perinatal mood and anxiety disorders, which means I work with individuals and their families around the time of pregnancy, before pregnancy, and after pregnancy. And I work with clients of all ages and genders.
Awesome. Such important areas for mental health, definitely. Okay, so jumping right into it now, as a person that has gotten therapy myself, I know that mental health issues can be really specific to the circumstance of the person going through it. But if you could give a person four signs or four things that they should look out for in considering if they need therapy, what would be those four things?
Okay, really good question. So, those four things, I think just to get started, it's with change. Sometimes you might notice a change in your appetite. You might be eating a lot, you may be eating much less, or you may have a change in your sleeping patterns, excessive sleeping, undersleeping, difficulty getting to a good night's rest. You're just feeling very restless. Another huge change, I would say, is really emotional changes. Maybe you find yourself overreacting to things, or you might find yourself having a hard time standing up for yourself and becoming caught in suspense of the emotions. So those are the clues that I would say is under changes. You're having a lot of emotional ups and downs, as well as difficulty eating and sleeping. Another area I would say is challenges. These are challenges in your relationships, challenges where maybe you're having a hard time expressing yourself, or maybe you're having a hard time exerting some boundaries. You might be having challenges in the workspace where you're not getting your job done in the same way that you're used to, or you're having a hard time adjusting. Another challenge you might say is just personal. You feel like you're carrying a weight on your shoulders and you are struggling to really maybe pull yourself out of what feels like a rut. So those are the challenges. Another one that I would say is also physiological clues. So when we're talking about physiological clues, we're talking about the things that are happening within the body, such as rapid heart rate, or feeling like your chest is tight, butterflies in your stomach, or nausea, maybe feeling like you cannot make it out of the bed because of fatigue, extreme fatigue. Those are ways that your body is telling you, one, it could be something that's physically wrong. And we always encourage going to get checked out with a physical and talking to your doctor, because you may have a deficiency in some vitamins, or you may have an overactive thyroid. There's a lot of different medical reasons that can be coming up to the physiological clues. And once all of those things are actually ruled out, one would suggest that maybe this is mental health related. Maybe part of the reason why it's hard to get out of the bed is because you are having a hard time facing your day. You are having a hard time really exerting those boundaries. So you might be struggling in the midst of a conversation and will maybe lose track of your thoughts, or even feel like you're having symptoms of a panic attack. So those are the physiological changes. And then the last one that I would say is recommendations. Sometimes we have times where people come to us and say, hey, I've noticed these things about you. I've noticed maybe you've been crying a lot more, or maybe you just seem to be in a really dark headspace. And one of the things you might want to do is talk to someone about it. So sometimes our friends, our family members, and even just close folks who get a chance to see us on a regular basis may have that recommendation. So those are some of the signs that this may be a direction you'd like to go in.
Okay, that's great. That makes it really digestible. If you look for, you said change, challenges, physiological clues, and recommendations. So those are some concrete things that even if you're not a professional and you're thinking about, do I need therapy? You can look at those 4 things and see if those things are happening to you. So that's really helpful.
Right.
All right. So my next question is, what should a person expect in their first therapy session?
So let's start off with the nerves. I mean, if this is your first time ever coming into therapy and it's your time to actually maybe put out some things and really discuss issues that you're having or concerns that you have, sometimes you can expect nervousness. A therapist who's well trained is used to working with this, so that's totally fine, especially when you're doing something new. They want to really make you feel comfortable. The next thing to expect is a lot of questions. So in our first session, it's really more so like an interview. It's you telling that therapist what you are coming for. So what are the reasons why you feel like you want to start therapy? Another thing is what you have been through. So we get snippets and snapshots of some of the things that you have experienced that may have played a role in who you are now and what as a result of looking at what you've been through. So there's tons of questions. I would say another thing that you can expect is knowing how the therapy should work. Does this therapist want to see you fairly weekly, or are they suggesting that you come in once a month or every week, every other week? So you kind of want to get an idea of when you'll be coming back. And generally they'll let you know that.
Okay, so that gives a good picture. So on TV you see like you walk into the therapist's office and you lay down on the couch and it's very relaxing. Is it really like that, or does it really just depend on the circumstance?
For the most part, we really do want people to feel comfortable. So you're going to see more often than not couches or maybe soft covering seats, maybe dim lighting, maybe music. And you're also going to want to kind of feel like you could be there for a little while, not sterile. So most therapist office will be something that feels warm, something that feels inviting and not uncomfortable. For example, the chairs that you'll have at the DMV, those won't be the same as you will have in a therapist's office. And most therapists will feel okay if you really get comfortable and relax, put your head back a little bit. It's never a place that you'll probably fall asleep, but you would feel relaxed enough.
That's definitely sounds good. Yeah, I felt relaxed in my therapy sessions, but I definitely felt like it was hard work. Like answering all the questions, I would feel like this was good for me, but it was definitely mentally taxing answering all those questions in that first therapy session. So I definitely understand where you're coming from with all the questions that they're asking.
Mm-hmm. And then, once you kind of get the adjusted to it, it may feel and it tends to feel better along the way and a little bit more natural, like you're having a conversation as opposed to informing a person like a one-way question and you answer kind of thing. So it takes a little bit of time because, of course, the therapist is just kind of trying to get to know you from your perspective and from the things you've shared with them.
Right, makes sense. Okay, so the next topic I wanted to talk about was a lot of people feel like they don't need therapy because they have close friends and family members that they can talk to and confide in. And so they say, I don't really need to seek out a professional because I have these great people that I can talk with that give me good advice. What would you say is the difference between the conversations that you may have with close friends and family members versus actually talking to a licensed professional about mental health?
So I think one of the differences is the professional training. For example, you may be exhibiting symptoms of a specific mental health concern, and family and friends, although they're well-meaning and they kind of have this intimacy with you, they may not be able to actually identify those signs and symptoms as well as a professional. The other thing I would also say is you get what could be that distance, or that neutrality that you'll have from a professional, because they're not as engaged in your specific home life. They don't see some of the back and forths, and sometimes that can lead to a biased opinion. So a professional counselor can be more neutral, or I would say objective as opposed to subjective. So we really do want that. And maybe even because they're a person who's not as involved in your life, you're more willing to talk about those deeper issues that are happening, because you are not as concerned of judgment, or even disappointing that person. So we really do see that professional counselors bring this level of neutrality, as well as professional ability to see the signs and symptoms.
Yep, that makes sense. I think that goes back to kind of the whole premise of this YouTube video today, is getting serious about mental health. I think a lot of people, I'm guilty too, kind of teeter on the edge and say, okay, I'm talking to someone, I'm talking to mom, brother, sister, whatever, but really not getting deep into those issues and really not getting serious about their mental health. And like you said, the only way really to do that is dealing with a professional who's able to identify some of the real mental health issues that you may be having, that a person that's not trained in that field wouldn't be able to diagnose. So that makes sense.
Sometimes you have a conversation with a loved one, and they are definitely listening and they're paying attention, but then you walk away kind of concerned that that loved one has heard those things, and some things you wish you might have wanted to unsay because you really weren't comfortable with talking about it. So a professional would be that safe space. Honestly, we're looking for a safe space where you can go do that work, and then you also can live very genuinely and authentically with your family and friends without feeling like you may have laid a burden on them that you would rather not have.
Yep. Okay, so I know each circumstance is different, but if you could talk about the top things that a person should expect to gain from therapy, what would you say?
So because of all that work that you're doing, being given this space to really explore and understand yourself and even how you interact with your environment, ideally you'd be walking away with insight. You'd be walking away with knowing some of your whys. Well, what is it that led to some of these changes, that inability to maybe control my eating, or that lack of appetite that I had? What was it that was happening within my personal life that that was the way I dealt with whatever that thing was? Also, what are some of the ways that I can assert myself, and some of the ways that I even need to better manage my emotions? So insight is one of the things that I would say you really want to walk away with. And along with insight, I think hand in hand goes coping skills, interventions. So having the breathing technique when I do feel that feeling in the midst of an intense moment, and it's feeling like a deer in the headlights, where I'm caught, whether it's my breathing or can't think straight, the butterfly feeling. So really knowing some coping skills to maybe self-regulate, and also having some practice with boundaries, having some practice with communication. So you want to walk away feeling like you've been equipped with quite a few skills. And sometimes it takes a while to know which ones work really well for you. So as far as the insight goes, understanding yourself, learning yourself, and then the coping skills are things to try when it feels as though you're becoming overwhelmed and needing some support and some guidance. That's what's going to sustain you outside of therapy, because therapy is generally maybe once a week or once every other week. So we really want those tools and coping techniques in order to sustain and maintain that change.
Yeah, that makes perfect sense. Actually getting skills that you can use and implement in your life to make you better. Because I know most people don't just go to therapy. I mean, of course, they're seeking someone to talk to or dealing with the issue, but you want to come out. Therapy is a time investment. It could be a financial investment. So you want to come out with some things that you can use to make yourself better, to improve your mental health as you go along. So those points really make sense.
Thanks.
Okay, so my last question is an important one. I think anyone watching this video may want to know this. What are resources that a person looking for a counselor or therapist or mental health professional can use to find someone?
I would say one of the most accessible resources could be friends and family. Oftentimes you will have a person who you're in connection with that has been into therapy and they may be vocal about it. So you might want to ask them for a recommendation. Hey, do you know of any therapists in our area or in this area who you would recommend? Then you would also want to look at Psychology Today. It's one of the premier online resources where therapists and organizations, behavioral health clinics, they promote themselves. So you can kind of see it almost like you would see, like a phone book where you would see various people and their specialties listed right there. But what I would say is one of my personal favorites is Therapy for Black Girls, which is an online directory where there are several women of color who have listed themselves as professional therapists in various areas. So you can find them via zip code. And while that is specifically to women of color, there will be other therapists directories, even if you're a person who is identifying as LGBTQ or of a Hispanic heritage. I'm pretty sure that there will be other therapist directories. So online would be probably your second most useful resource.
Okay, yeah, those are great resources and easy at your fingertips, literally on your phone or on your computer that you can search. I know I personally use Psychology Today too. It's pretty easy to use. And like you said, friends and family, that can be one of the quickest ways to get somebody to just give you a recommendation and go from there. So that definitely makes sense. And I hadn't heard of Therapy for Black Girls, but that is great. I'm glad that that resource is out there because it's so important in our community. I'll definitely leave that information in our description box for the viewers so that they can see it there and use those resources. That's really helpful. Nali, thank you so much for being on TXT Tell Us All. You have given us so much great information about mental health and how to spot if you need therapy and how to seek out a therapist. So I hope this video helps somebody out here who is in need of therapy or trying to decide if they need therapy, but you are obviously an awesome professional. So I just want to say thank you for your time, and hopefully we can see you back on TXT Tells All in the future.
Oh, I would love that. I would love that. It's been my pleasure. I will say that in the times that we're living in right now, just given COVID, race relations, there's not a better time to step into a relationship with a therapist and really getting to do that work, because we are looking to get stronger through this as opposed to just really getting pulled into the inner workings of not feeling well and not taking care of ourselves. So, if anything did resonate with people, I would hope that they would take that first step. It does take a lot of courage. I believe that the first session can, really requires a lot of vulnerability, but it is well worth it and you are worth it. So I would hope that all of your viewers would definitely invest in themselves and will step into that moment as well.
Yes. Thank you so much. Take care.
Thank you. Bye.
Bye-bye.